If something doesn't feel normal, if somebody is not getting better, if they're staying the same or they're disimproving, certainly disimproving rapidly, trust your gut. Ask the question, could it be sepsis? Could it possibly be sepsis? Even if it seems unlikely, trust your gut.
You've just heard from Maeve Murphy sharing her story of surviving sepsis, as told in our previous episode of the Walk and Talk Improvement podcast, Could This Be Sepsis? Many of you will know that sepsis is a life-threatening condition. It's the leading cause of mortality across the country, contributing to over 3,000 deaths annually in Ireland. But what many people don't know is that 1 in 5 people who get sepsis dies. And as healthcare workers, it's crucial to know where to access information and tools to effectively identify and manage sepsis early, because early recognition of the signs and symptoms of sepsis saves lives. Welcome to episode 13 of the Walk and Talk Improvement podcast. I'm Juanita Guidera, a Programme Manager in the National Quality and Patient Safety Directorate of the HSE. And today, our guest is Denise McCarthy, an Assistant Director of Nursing with the South Southwest Hospital Group. Whatever your role within healthcare, join us as we explore the latest guidelines, protocols and resources for the early detection and management of sepsis that can make a life-saving difference. Denise, thank you so much for joining us today. We might start off with, what is sepsis?
Well, sepsis is infection with organ dysfunction. It can develop when your body has an extreme reaction to any infection. Sepsis is a life-threatening illness and it damages the organs and it can kill 1 in 5 people. In 2022 in Ireland, we had almost 15,000 documented cases of sepsis and septic shock within the acute hospital setting. So the numbers for sepsis are quite high.
What are the symptoms of sepsis?
We use the acronym Sepsis, SEP-SIS, to look at the signs and symptoms because we know that sepsis can be difficult to diagnose. So when we look at S, slurred speech, new confusion, they're too sick to communicate or drowsy. E for extreme shivering, muscle aches, fever. P has not passed urine in the last 12 hours or does not feel like passing urine. Shortness of breath, lips tinged with the blue colour. You feel like your heart is racing. You're dizzy when you sit or stand. People who survive sepsis often say, I feel like I'm going to die. S for skin mottled and discoloured, a new rash that is still visible when pressed on with clear glass.
So I know when we talk about the definition of sepsis, we talk about organ dysfunction. And to me, that sounds very, very serious. But when I hear the list of symptoms, to me, they could be linked to anything. It could be a cold or a flu. How do you know that it's sepsis?
So we would know that it's sepsis by putting the pieces of the jigsaw together, looking at the clinical picture of the patient. So when you do their observations, looking for the signs of organ dysfunction. So when we talk about this in, I suppose, medical terminology, you're looking at what is the respiration rate? Is it higher than normal? Like we'd be looking at an increased heart rate, like a tachycardia. We would also look at like a new onset confusion. So you say kind of similar to a flu. Yes, but I suppose it's the extremes of flu. Like I feel like I'm going to die, like the worst flu you've ever had in your life. But I suppose when we're talking about in the clinical setting, in the hospital setting, looking at what are their observations, are they outside the normal parameters? And if they are outside of the normal parameters, we're putting the pieces of that jigsaw together to see, is there suspicion or confirmed infection? And if there is, then with these parameters outside of the norm, could it potentially be sepsis?
So just to check, does somebody with sepsis always have all of those symptoms?
In short, no, they wouldn't have all of those symptoms. But you're looking at the clinical picture, looking at the history of the patient. And by using the clinical decision support tool, i.e. the sepsis form, it'll help to guide and inform your decision. So no, you wouldn't have to have all of those. But also important to give safety net advice that maybe they're not displaying these signs and symptoms now, but potentially they may, especially if somebody's been discharged home from hospital, to give safety netting advice is important. When should they re-present back into hospital if they do start to display symptoms or signs or symptoms of sepsis?
Okay, that's really helpful. And in Ireland at the moment, you say 1 in 5 people who have sepsis can die. Why do you think the outcomes are so serious?
with sepsis, it's very difficult to diagnose. Unlike heart attack or stroke, where you have tests that can quickly identify that you're having a heart attack or having a stroke, with sepsis, we don't. And often with some of the tests that we do, like our blood cultures, we mightn't get results back on those for 24, 48 hours. And often they're actually negative. Listening to your patient, what are they saying to you? The soft signs of deterioration, for example, looking at their observations. Are they outside of the norm? Are they triggering on their scoring system, on their iNews? Sometimes it can be subtle changes in the patient, maybe, a slight new onset confusion, especially in somebody who's already got a baseline of confusion. When we look at some of our patients, they may have a delirium. They could be delirious, the climbing out of the bed delirious, but also somebody who's much quieter than normal. That's a sign that somebody could potentially be displaying signs of sepsis as well. So knowing your patients, knowing the signs and symptoms, and then escalating appropriately, looking at the full clinical picture for a patient as well is important.
Okay. And you've cared for many critically ill patients over the course of your career. If a patient presents with possible sepsis at the moment, what should happen next? How is it treated?
So how do we treat sepsis in hospital is with antibiotics. So we talk about the sepsis 6, the give 3, the take 3. And I'm sure most healthcare workers would have heard that. So when we talk about the give 3, we give an antimicrobial or an antibiotic. We give IV fluids if necessary, and we give oxygen if needed as well. When we take 3, you're taking your bloods, including your lactate, blood cultures, and also taking urine output as well to monitor, make sure that we're monitoring the urine output, because we know that a reduction in urinary output is often one of the organ dysfunction or is an acute kidney injury. So the sepsis 6 is how we would manage it.
Okay. And do you always have to have a positive diagnosis of sepsis in order for treatment to commence?
No, you wouldn't. It's suspicion of or confirmed infection. So sometimes you'll have a confirmed infection, but sometimes you think that the patient may have an infection and you will treat them, give them the sepsis 6. And that infection then may not progress into sepsis. They may not get an organ dysfunction from the infection because you've given them the early treatment.
Okay. And early treatment is key really in sepsis.
Yeah, early recognition and early treatment. So recognizing that there is potential for sepsis, rule it out. The thing that we would always say to healthcare workers rather than rule it in. If there's a suspicion of infection, try to rule out sepsis. Yeah.
Okay, that's helpful. We know at the moment that 44% of people don't know the signs and symptoms of sepsis. Is there anything we can do to change this to improve patient outcomes?
Going back to 2016, the National Sepsis Programme at the time did a study, and it looked at the association of did you have to have infection to have sepsis. And I suppose the results of that were that about a quarter of nurses and doctors didn't think that you actually needed infection to get sepsis. So there's been a lot of work done since then around the education, the recognition of sepsis. It's important that you listen to your patient, your carers, listen to your gut as well. You'll know your patient, you'll know if something's just not right. Listen to the patient, the carer, or the parent, even if they're telling you, my child, my father, my sibling is just not right, there's something off their baseline. Listen to them, they know them better than anyone else. And investigate, rule it out, reassure them that maybe it's not sepsis. Particularly if somebody's confusion, like I said earlier, the dementia patient who is baseline already confused, if they're more confused than normal or much, much quieter than normal, this is when we should be looking at, is this an early sign of a new onset confusion? Maybe it's because of an infection. Using the tools that we have in hospital as well. We use these tools, the iNews, the Irish National Early Warning Score, the Pediatric Early Warning Score, the PEWS, or the iMuse, the Maternity Early Warning System as well. We use all these scores and systems to look at the acuity of our patients and escalate appropriately then using those tools.
Yes. And I think that piece about escalation is important. If you're not sure, or no matter what your role, if something doesn't seem right with a patient that you might know or have a relationship with, to escalate if you're concerned.
Yeah, by using the tools, it guides us. You look at the score and you can escalate appropriately. But these tools allow for clinical judgment as well, for the experienced nurse or doctor or whoever it is, to say that there's something just not right here, even though the score might be normal. The tools allow for clinical judgment as well, for the experienced nurse or doctor or whoever it is, to say that there's something just not right here, even though the score might be normal. The tools allow for clinical judgment as well, for the experienced nurse or doctor or whoever it is, to say that there's something just not right here, even though the score might be normal. but there's something just not right and I should escalate. For example, you might have a person who's doing the teas in the morning, and they might be there every single morning, and they know that John is just not himself today. That should
Yes.
be a trigger for the healthcare worker to say, oh, I'm going to do a set of observations and see what's going on with the patient. Because, between shift patterns, you mightn't see the patients every day, so you mightn't know their baseline. So it's really important that you listen to other people as well, the people who know them, and listen to that and escalate if appropriate. Always
Gotcha.
speak to whoever's in charge and escalate as appropriate then as well.
Yes. You had spoken as well about the form as a clinical decision-making tool. A lot of people consider forms to be time-consuming or sometimes an unnecessary admin burden when they're already stretched and under pressure. In this case, do you think that using the sepsis forms actually helps?
Definitely, yes. We'd always advocate using the sepsis form. And you're right, people do say that they feel that the forms can be cumbersome. But by using the form, it does help to guide your treatment. They're a clinical decision support tool. So, it's not just a sepsis form per se, it's a clinical decision support tool. So it helps you to guide the management. You fill out the form and you're completing the care of your patient. You go back to review the patient and you complete. So it also helps with the diagnosis of the patient. Is it not sepsis or is it sepsis after we've given the treatment to the patient? It also helps with the diagnosis, as I said there a while ago. When we did last year in our audit findings, we found that by using the sepsis form, it increased the incidence of the correct diagnosis of sepsis by 43%, which goes to show that using the forms does help with diagnosis.
Okay. And I know you've mentioned that the form prompts the different actions to be taken as well, and that's helpful.
It does, yeah. And they're designed by staff with expertise, and there is evidence of their benefits by using them. So it's important that we do use the tools. Makes it sometimes when your shift patterns, if you're finishing earlier and there's a patient who needs to be re-reviewed, when you come back to look at your patient after somebody else has started the form, you'll see exactly the care that they've given. You don't have to go through reams of notes to find out what care was given. So it's all on the one form and it's easy to find. And the other thing with the form is it's a national standard as well. The same form is used in every hospital in Ireland. You've got NCHDs moving between hospitals, nurses moving between hospitals. So it's the one standard form, whereas the notes might be different. The form is
Yeah.
always going to be the same in hospitals. So it really helps to guide the doctor, the nurse, or whoever's completing it. It's the exact same everywhere.
Yeah, it supports that clinical decision making in a faster
Yeah.
way. Yes, yeah. And can you tell me, as a healthcare worker, are there other resources that I can access to improve my knowledge and understanding of sepsis? What should
Yeah.
I be looking at the moment?
Well, we've our national clinical guideline, which is available online. So that guideline is there. Other information that you can get is on our website, www.hse.ie/sepsis, where you'll get any other information, posters, information leaflets. Also on healthpromotion.ie, you'll get information leaflets as well for the public. So we have the e-learning module, which is for adult, including maternity, and also a pediatric module there as well. And that is, mandatory in all hospitals to complete that. We would encourage everyone to do that. You've got 7 different sepsis aid-ons as well, one affiliated with each hospital. And where our details are all online on the website as well, if anyone ever wants to contact us for anything as well.
I think there's a new patient leaflet as well that has a good synopsis of information on it.
Yeah, so the patient information leaflet is available on healthpromotion.ie, and that's in 10 different languages now as well. So that's
Fantastic.
available to download and to be ordered as well from there.
That's really helpful. And GPs are an essential part of this process to diagnose sepsis within the community. Is there any work happening with them directly? A lot of the
Yes,
work we've talked about is within the acute setting.
yeah. So since the start of the program, as you say, the program did start initially with the acute sector. So there's been a lot of work done with adult, maternity, and pediatric sepsis within the acute hospitals. Whereas actually now going forward, there has been work going on in the background with GPs looking at developing a guideline or an information for GPs on the management of sepsis in the community. We know that 80% of sepsis actually begins in the community. So we have 2 GP leads now in place, one for adult and one for pediatric, looking at sepsis management in primary care. So hopefully in the next couple of months, in the next 12 months, that we should start to see that we are working more closely with GPs and looking at management of sepsis infection in general practice.
That's good to know. And in particular, when we're looking at integrated care, it's so good to see the balance across all of the services.
Yeah. Oh, it's good to have the common language as well to bridge the gap between the GP and the hospital so that we're using common language as well. When you present into your GP, the information that either the safety net advice that goes to the patient or else what's written on the letter for the patient when they come into hospital, so that if there's a suspicion that there could potentially be sepsis, that's communicated effectively with the acute hospital as well if the patient has been transferred in. So we are working closely with emergency doctors, GPs, to make sure that there's a common language between everyone so that we're all, as I say, singing off the same hymn sheet, that there be no confusion between the two different
And I think from a patient safety perspective, that's ever more important because of the importance of a timely response when it is a suspected sepsis case. So that's really positive to hear. There is a new patient safety alert as well. Could you tell us a little bit about that and who
Yes.
developed it?
So the patient safety alert that came out just before Christmas from the National Quality and Patient Safety Directorate and the National Sepsis Programme. So but the title of it was Sepsis in Children and Young People. It really was just, over the winter, there's an influx of children presenting into the emergency departments with different types of infection, RSV, viral, into busy emergency departments. So it really was to look out, to remind people just to look out for the signs and symptoms of infection. Think sepsis. Look for things like limb pain, tachycardia that is not explained by injury, fever, or crying, particularly if the child is on treatment or prescribed treatment for the same complaint. Listening to the parent or the carer. Sepsis should be considered if there is a viral illness and for somebody who's returning for assessment. Suspect sepsis and escalate as appropriate using the eyes bar. And just to remind people that sepsis is a time critical medical emergency and to follow the sepsis 6 protocol and escalate without delay. So really, I suppose it was just in advance of the winter season, just to not forget that escalate and identify early and give early treatment and recognition.
I think it's helpful as well to have a lot of those resources in one key document that has been developed by experts in that area.
Yeah.
It's hugely helpful, and to know that you can trust it as a source of information in this area.
Yeah, and it's all in one place as well, so you can just refer back to that, one piece, and it can be distributed widely then amongst healthcare workers so that people are aware. Yeah.
Yes, yeah. And I know the National Quality and Patient Safety Directorate, where this podcast comes from, Patient Safety Together website has a lot of different alerts on it that are useful to healthcare professionals. And I think it's helpful to know that as well, that there's a much broader set of resources there available to people.
Yeah, and up-to-date information as well, yeah.
Exactly. I know we can never fully eliminate or prevent sepsis, but do you think, is there anything we can do to reduce the risk of patients getting sepsis?
Yeah, so as healthcare workers, my background is infection prevention and control as well as intensive care. So I'm very passionate about preventing infection. It's much easier to prevent it than it is to control it.
Yes,
So by, I suppose, following standard precautions, the hand hygiene, wearing the PPE to protect ourselves, but also protect our patients as well. Giving the patients information. If you're a healthcare worker and you're sending a patient home with a complex wound or a PICC line or a urinary catheter or a drain, and we're expecting patients who are lay people to manage these at home, giving them the information that they require to make sure that they manage these things effectively at home. Give them the advice and what to look out for, what signs and symptoms should they look out for. So making sure that we've educated our patients as well, because I suppose we as healthcare workers, we know what the signs and symptoms are. People in my house know exactly what to look out for if they've got infection, whereas most people don't. And this is the thing, we hear people, they've never heard of sepsis before, I never heard what it was. So make sure that we give them all the tools or all the information that they need to manage themselves. If patients have had surgery, making sure that we're properly managing wounds, not to underestimate the effort of making healthy lifestyle choices, encouraging our patients to live healthier lives. We know that healthy people are less likely to get infections. As a healthcare worker as well, it's important for us to keep up with our vaccinations. For example, flu, COVID. We know that if we're looking after immunocompromised patients, for example, or cancer patients, patients who are on high dose steroids, these patients are more susceptible to getting infections, viral infections like the flu. And although they may be vaccinated themselves because they're immunocompromised, me as the healthcare worker being vaccinated, although I'm healthy, I could still potentially pass on the flu to that vulnerable patient. So we're offering our patients that extra bit of protection by being vaccinated ourselves. So that's important as well. When I say talk about educating our patients, if they don't know, they won't know. So it's important that we give them all the information, as I said, give them the leaflets that they need, and give them our numbers if they need to ring us as well, because some people are working in clinics and they're able to take calls as well from patients. So give them all the information that they need.
Yes, yeah. And I think it's important to mention from a health literacy perspective that almost half of the people who go into a healthcare appointment will leave with questions that they haven't asked because they don't understand. And that can be because they've taken in a lot of information on a particular date and, they've been overwhelmed, or they've had bad news, or it can be just difficult. Sometimes the language within healthcare can be quite challenging for people to understand. So confirming that check back and making sure that somebody fully comprehends, if we're given, information on wound management, that they really understand, well, what is it that we're asking them or supporting them to do. I think that can be really important.
Yeah.
Okay. So Denise, as we come to the end of the podcast, is there a key message that you have for colleagues?
Yes. If you're thinking or suspecting infection, think sepsis. Use the support tools, the clinical decision support tools, i.e. the sepsis forms, the maternity, pediatric, adult forms. Use the forms, they will help to guide you. The main message to get across to my healthcare worker colleagues is use the tools that we have, use the early warning scoring systems that we have, escalator programs, use the sepsis form as your clinical decision support tool. It'll help you to diagnose your patient. It'll guide how you manage your patient, and it'll also be the documentation of what was done for the patient.
Okay, so that's really helpful. Thank you. Can you tell me, why is this work so important to you?
I'm very passionate about patient safety. I have looked after patients in intensive care with multi-organ failure because of sepsis. Now I'm in a job where I can really promote about early recognition, the patients before they get into the intensive care unit. So I'm really passionate about patient safety and giving patients the best possible outcome, the best possible chance to survive if they do have sepsis.
And the last question then is just, who can I contact if I have questions?
You can look up our website, www.hse/sepsis, where all of our information is. On that website, you will see the sepsis add-ons. So there's 7 separate add-ons, one affiliated with each hospital group. So for every hospital, there's a sepsis add-on. Now, you may have your own links in hospitals as well, but all of our contact details are there. So we'd be more than happy to provide education, any other further information as well. And also on healthpromotion.ie is where our information leaflet is as well. And that's available to download and to be ordered as well.
Okay, that's fantastic. Thank you so much for joining us today and for your time. I think there's a huge amount of information there for people, and I think it's always helpful to know that there's a whole suite of resources available for clinicians and for patients online. We do want to change things. 1 in 5 people dying with sepsis, it's so significant that we hope that few people take something from today, that there's something beneficial coming out of it. So thank you for your time.
Thank you.
As we come to the end of our podcast on sepsis, we thank Denise for sharing her vast experience and wisdom on sepsis with us. Reducing and managing sepsis is a key patient safety improvement priority of the National Patient Safety Strategy. And we hope that this episode has helped you identify the resources that will support you in your work and at any point in time. If you have questions, that you now know where you can go for support and help or guidance. The All Ireland Walk and Talk Improvement podcast aims to improve patient safety and quality improvement by capturing personal stories of people who work in and use health services across Ireland. The series is co-produced by patient partners and members of the Health and Social Care Quality Improvement Northern Ireland and HSE National Quality and Patient Safety Directorate teams. This episode was co-produced by Sheema Lughmani and Juanita Guidera, with guests Maeve Murphy and Denise McCarthy. Thank you for listening.